Hello everyone, I am going to talk about the gross features of male urethra. This section includes the course of the urethra, its parts and features, internal and external urethral spindles, its blood supply and difference between male and female urethra. Here what you are seeing, this is the sagittal view of male pelvis. Here you can see this is the anterior aspect, this is the posterior. You can see the pubic symphysis, this posteriorly sacrum with the coccyx. See, this is the urinary bladder, this is the apex, this one is the superior surface, this part that is the base of the bladder. Then here you can see this is the prostate, here this is the urogenital diaphragm, this part this is the penis, here this is the bulb of the penis, this one is the body, and this part is the glans. Then here we can see this the neck of the bladder. There will get here, this is the internal urethral orifice. So urethra, it's a muscular tube, extends from this internal urethral orifice to the level of this external urethral orifice here for the exit of urine. Okay, so it travels this prostate. Okay, that part of the urethra is called the prostatic part of urethra. Then through this urogenital diaphragm, here this urogenital diaphragm, that part is the membranous part of urethra. Then through this penis, that is the spongy part or the penile part of urethra. Then here also we can see this the sagittal view of this bladder or the urethra. This is a bladder. Here this one is the prostate. Here you can see this the deep perineal pouch. Here this is the penis, this is the bulb, this one is the body, and this one is the glans. This bulb forms the fixed part of the penis, and this body and glans forms the free part of the penis. Here you can see this is the blue color structure, that is the urethra. Here this is the internal urethral orifice. Then here you can see this one is the external urethral orifice or meatus. Then it's the total length of urethra, that is 18 to 20 centimeter in males and 3 to 4 centimeter only in females. Okay. Then coming to this course and parts, here it begins from this neck of the bladder. There, here this is the neck of the bladder, as here this is the internal urethral orifice. Then it runs forwards, downwards through this prostatic part, through the prostate, okay, as prostatic part of urethra. Then pierces the superior and inferior fascia of urogenital diaphragm. That inferior fascia, that is called the perineal membrane, okay, pierces the sphincter urethra muscles. Then it reaches the bulb of penis, then travels through this body and glans, then it exits as external urethral orifice. Once it pierces the bulb, it runs forwards and upwards. Its course is here at forwards and upwards. Here you will get the pubic symphysis. At that level, it bends downwards and forwards through this body, then through this glans, then exit as the external urethral orifice. So in flaccid state, the spongy part, this one, it appears as S-shape. There you can see two curvatures. There is a proximal curvature here, this is the proximal curvature, and there is a distal curvature. Okay. In erect state, it is J-shape, this spongy part. There is the obliteration of this distal curvature, it's not there. Only you can see there is the proximal curvature is there. So proximal curvature will be there. Okay, it goes like this. Then there is the obliteration of the distal curvature. So it should be like this in the erect state. What you are seeing, this one is in the flaccid state. Okay, so this is the proximal curvature, this one is the distal curvature. And also it shows two dilatations here in the spongy part. Here you can see at the level of the bulb, this dilatation here, this part is the intrabulbar fossa. Here in the glands, this dilatation here, that is the navicular fossa. Okay. Then here it's also same, the parts of the urethra. Here you can see this is the bladder neck, prostate. This one is the fixed part and free part of the penis. Here this is the prostatic urethra. Here this area that is the membranous urethra. Then here this is the penile urethra or the spongy urethra. Then here you can see the neck of the bladder. This is the lateral view of the bladder with prostate. See the apex, superior surface and base of this urinary bladder. See, this is the neck, it relates to the prostate. There you can see through the prostate, there is the urethra. Then coming to the features of this prostatic part of the urethra. Here, this is the frontal section, what you're seeing, the posterior wall of the urethra. Here, this part is the prostatic part. This is the internal urethral orifice. You can see the prostate gland. Then see the middle of the prostatic part. There is a mucosal elevation that is called the urethral crest. This mucosal elevation, that is the urethral crest. Over that mucosal elevation, again there is some elevated area that is called the seminal colliculus. That is the seminal colliculus. On that, you can see the opening of this prostatic utricle, and also two in front, that is the opening of this ejaculatory ducts. This we are already explained. This prostatic, what is prostatic utricle, and this one the ejaculatory ducts. Okay. Then each sides of this seminal colliculus, you can see there is a space there that is called the prostatic sinus. Here that space is called the prostatic sinus. There you can see the openings of this prostate glands. You can see the glands opens into that sinus. Okay. That's about the features of the prostatic part of the urethra. Then coming to this membranous part, here this is the sagittal view. Here the anterior, this is the posterior aspect. So this is the prostatic part. Here you can see this is the urogenital diaphragm. Okay, this is the superior fascia. Here this is the inferior fascia that is the perineal membrane. Here I'll get two muscles, deep transverse perineum and the sphincter urethrae. Okay, now also in this deep perineal pouch, there you can see one gland is there, that is the bulbourethral glands. This is the bulbourethral gland. It opens, see the duct opens into this intrabulbar fossa of this spongy part. The duct opens into the intrabulbar fossa. Okay. So this part, the small part, this is the membranous part of this urethra. It's only some 1.5 to 2 centimeter in length. This prostatic part, that is 3 centimeter in length, and the spongy part or the penile part, that is 15 centimeter in length. So average length. Here the diameter of this spongy part, that is 6 mm. That's about the membranous part. Then coming to the spongy part, here you are seeing this the frontal view, okay, of this anterior half of the urethra. This is the anterior half. This one is the posterior wall of that urethra. Here this is the internal urethral orifice. Here we'll get the external urethral orifice. So from here to here, this is the urethra. It travels the prostatic urethra, travels this urogenital diaphragm, membranous urethra, through the penis, that is the spongy or the penile part. See here, Here this part, this is the intrabulbar fossa. Here this dilated part here. This dilated part here at this free part, okay, the most distal part, that is the navicular fossa. That is the navicular fossa. Then in the posterior wall there are numerous urethral glands opens. Okay, the openings of urethral glands that collectively forms the Litters gland. That collectively forms the Litters glands. Okay. Then additional to that, there are some recesses also can see here in the wall, that you can see here the recesses cavities are there. These recesses or cavity that are called the lacunae of Morgagni. Here you can see the lacunae of Morgagni. Okay. Then one of that recesses is large. Okay. And he can see on this navicular fossa, that is called the lacuna magna. Okay, the small recess over that spongy part that forms the lacunae of Morgagni. The one's large recess that you can see in the navicular fossa just before this external urethral orifice, that is the lacuna magna. Here we'll get the lacuna magna. That's about the spongy part. Then here you can see the urethral spindles. Here it relates to the neck of the bladder. Here you can see the neck of the bladder. There is the longitudinal muscle or longitudinal layer of this urinary bladder muscle, detrusal muscles, forms this internal urethral sphincter. Here there is the internal urethral sphincter. It's under autonomic control. So when this detrusal muscle contracts, the internal urethral this sphincter relax and the orifice opens. Okay, there is the opening of that orifice. Then by means of that, urine gets exit through this internal urethral orifice, then to the urethra. Then here we'll get this one is the, here relates to this prostate. Then at the level of this deep perineal pouch, there is two muscles are there, deep transverse perineum and sphincter urethrae. The sphincter urethrae forms this external urethral sphincter. Okay, that is from the ischiopubic ramus. Each sides of this ischiopubic ramus, this muscles interdigitates with each other in the middle and forms this external urethral sphincter. It's voluntary and its nerve supply, that is through the somatic nerves. So it's voluntary, so it can hold the urine, the voluntary control over this urine. Okay, so that's about this external urethral sphincter. It's voluntary, it's skeletal muscle. Here internal urethral sphincter, that is the longitudinal, the detrusal muscle. Okay, it is involuntary. That's about this urethral sphincters. Then here you can see this is the sagittal view of the female pelvis, the anterior aspect. See the posterior aspect. Here pubic symphysis, sacrum with the coccyx. See the urinary bladder. This apex, superior surface, base can see here, base of the bladder. Then here you can see this is the neck of the bladder. Here this area, neck of the bladder, it's the internal urethral orifice. So it begins from the neck of the bladder through this perineal membrane. It travels this perineal membrane and the pelvic floor muscles here, and opens directly onto the perineum. That's on the vestibule here. This is the orifice, external urethral orifice on the vestibule. Its length is 3 to 4 centimeter. That's a female urethra. Here it's the difference between this male and female urethra. Its length 18 to 20 in males. Here it is average is 4 centimeter. Then here the functions there is only urination here, that is urination and ejaculation. Once there is ejaculation of semen, there is the closure of the internal urethral orifice. Okay. Then there is a main difference between male and female urethra. Then blood supply of this urethra, here male urethra, that is mainly through this inferior vesical branches and middle rectal branches from this middle rectal artery. Then dorsal and the bulb of the penis, arteries of the dorsal artery, the penis, and the arteries of the bulb of the penis. Female through this internal pudendal artery and this vaginal artery. These all are the branches of this internal iliac artery. Then now supply here can see the parasympathetic, that is through this pelvic splanchnic nerves. Here this parasympathetic through this pelvic splanchnic nerves. Sympathetic preganglionic fibers from this T2, T12, L1, L2. Then somatic, that is the external urethral sphincter, gets its supply through this pudendal nerve. Okay, branch of the perineal branch of this pudendal nerve. Then lymphatic drainage, this posterior part of urethra. Okay, posterior part of the urethra, that is the prostatic part of urethra, and this membranous part of the urethra forms the posterior part of urethra. Okay, the spongy part forms the anterior part of urethra. Spongy part forms the anterior part. So this posterior part of the urethra, lymphatic drainage to this internal iliac and this external iliac lymph nodes. The anterior part to the superficial and deep inguinal lymph nodes. Okay. That's all about the features of urethra. Then describe the male urethra under the following headings. One is the parts and features. It's urethral sphincters, about this internal and external urethral sphincters. The parts, which are the parts, that is the prostatic part, this membranous part, and the spongy part, which are the features of those areas. Then blood supply of the urethra and its nerve supply. Thank you.